All right, so it's 12 o'clock. So good afternoon, everyone, and welcome to this week's webinar, this Wednesday's webinar. You may add your questions and comments to the chat box or unmute yourselves using the mic button. This session is recorded and posted to our website, which can be accessed at the link provided here. I'll also include a link in the chat box. Contact for this presentation is Jennifer Fielder. You can reach her at jlfielder@anthc.org. The CE information right here. To claim CE, participants will engage live or via recorded access and complete the electronic evaluation to obtain a CE credit certificate. Credit for enduring access expires 1 year from this recording date, so that would be January 19th, 2023. At the end of this presentation, I will include a link to claim your CE credit in the chat box. Thank you.
Thanks, Ryan. Today we have Dr. Chris Paramali from South Central Foundation Palliative Care. He's going to give us an update on the statewide transition from the Comfort One to the POLST. I think this will impact a lot of us currently practicing here in Alaska. So thank you for taking the time to present to us, Dr. Paramali. And I'll hand it right over to you.
Thank you so much, Dr. Pohl. I appreciate it. So it's an honor to be on today and to be able to share about the Alaska POLST. As Kyle just mentioned, I'm a palliative care physician and I work as a palliative support consultant here at South Central Foundation. I work in different settings. I work in the outpatient setting, home-based setting, as well as village settings throughout South Central. And it's just, again, great to be able to share the news about the Alaska POLST. Had the honor of being a part of the POLST, Alaska POLST Committee, core committee. We've been meeting for about 5 years, so it's great to finally see this program be instituted through regulations. And so I look forward to sharing more with you about this. I'm gonna go ahead and pull up my presentation and tell you more about the POLST program. So I would like to just also give a big shout out and thanks to the Alaska POLST Education Committee. So a number of the slides for consistency were taken from their slide deck. So I'll be sharing those with you today. And I want to thank everyone. Just with the pandemic and COVID-19, I just can't tell you how amazed I am by all the disciplines across the Alaska Tribal Health System and all the care and compassion that you poured into our patients and families through this pandemic and to one another. And so I just so honored to work alongside each of you. And so I just wanted to give a shout out to all of you with all the great work that you're doing. So I have no conflicts of interest. And really today I wanted to first dive into advanced care planning and some of the resources that are available at Alaska Native Medical Center. Because advanced care planning, the POLST is one of many documents that can be used for advanced care planning. And then we'll be able to talk about the Comfort One program and this transition to the Alaska POLST, kind of compare and contrast some of the similarities and differences of these forms. And then we're going to talk about how do you locate an Alaska POLST when you need it, as well as the educational resources that are there to support you when using this form. So this is an advanced care planning wellness map that we created for advanced care planning here at Alaska Native Medical Center. And I just share this with you to start off our talk to just really let people know when you're diagnosed with a serious illness or injury, it's just life-changing. And I think this conversation map or this advanced care planning tool just really demonstrates the complexities and the challenges when our patients or ourselves are faced with a serious illness. There's just so many twists and turns, and especially if you've never gone through a serious illness or had a loved one that's gone through it, it can be quite complex. And I want to point out the map that's there on this map. That map there in the corner really represents advanced care planning. As healthcare professionals, we have been on this river a number of times, seeing people navigate through a serious illness or injury. And I envision ourselves as being guides. So you'll see that person in the corner there. We're really the guides to help patients as well as families just know how to navigate through those twists and turns, because you know, a lot of times people feel isolated or alone. And so I just share with you that the POLST is a tool. It's part of that roadmap or that map for this journey that someone's going on to be prepared. And it really focuses on the right side, where you'll notice the bear trying to decide what someone wants. Do they want to be at home, or do they really want aggressive or medicalized care, especially at the end of their life? And so the POLST is a tool to help guide not only family members who are making these decisions, but most importantly, us as healthcare providers. So it's an order set that guides us on the medical wishes of our patients. So I wanted to share this slide. It looks at a number of different studies, and it's kind of surprising. It shows that there is this great divide. Even though there's 70% of patients prefer to die at home, it's actually 70% of Americans die outside of the home. And 83% of people say that it's important to put their wishes in writing. And in actuality, it comes down to about 23% say that they actually did that. And then about 92% say it's important to discuss their wishes, whereas really about only 32% ever have that conversation. And studies show us that, you know, people who die in the ICU, that there is a 5 times increased risk of PTSD for loved ones versus someone dying at home with hospice. And I want to use hospice loosely, because end-of-life care, especially in the Alaska Tribal Health System, means dying at home, maybe in a place that does not have hospice. So I want to recognize that. They also say there's an 8.8 times increased likelihood of prolonged grief in loved ones who die in the ICU versus dying at home. So these are realities that we have to think about. The other thing that I wanted to mention is that, you know, when you survey, this study surveyed providers, 99% of doctors feel that it's important to know the wishes of their patients at the end of life, when in actuality, about 21% report that they are asking about it. So I guess one of the big questions is, why is that? What are the things that are kind of those barriers that get in the way of us talking about advanced care planning? There's a lot of different things to think about. Number one, there's the patient barriers. There's a lack of awareness, denial. There's cultural taboos, confusion about the topic. However, on the flip side, as mentioned, 92% say that, gosh, having this conversation is important. The other challenge is forms. They're not standardized, and they're often difficult to understand. And as a medical community, what's tough is that we oftentimes only bring it up when someone is seriously ill or dying, when really this is a conversation that we should be having way upstream, even before someone's diagnosed with a serious illness. You know, we say that anyone 18 or older should have an advanced healthcare directive, and it's about the conversation and not the form, and that these are ongoing conversations that we should be having throughout life. It can sometimes be confusing as well. For example, against healthcare directive, we ran it through the fleshability, and you have to have a master's degree to be able to under quite complex or challenging. And then there's the provider barriers as healthcare teams. Oftentimes we lack medical training. Conversations take time. They can be really long conversations. And then the other big thing that we often hear and studies show is that worry about taking away someone's hope. And they've actually done studies to show that it's actually the opposite. These conversations don't take away, but rather provide comfort for someone knowing that they've prepared or they've thought through these things, or that their family is all on the same page as them, and knowing that their healthcare team is aligned with their goals of care. So these conversations are super important. And the other great news is that studies are showing that all of us, no matter who you are, can have these conversations if you have the training that you need. So advanced care planning tools here at the Alaska Native Medical Center, there's a lot of great things that we have in place to do this well. So within Cerner, our electronic health record has been revised so that it's very easy to find advanced directives and advanced care planning documents such as the POLST that we're going to be talking about today. There's also standardization of the scanning process, because a lot of institutions don't have a standardized way, and these forms get lost in legal documents and all the other documents, so you never know where you can find them. Well, the wonderful thing is we have a centralized location for these forms to be able to be found, and most importantly, administrative staff are being trained on how to scan these and where to scan them. And then there's a lot of different trainings, just like today, we're having this training for our healthcare team members to know how to have these conversations. And we've done a lot of public relations campaigns, both at ANTHC and South Central Foundation and regions across the Alaska Tribal Health System, promoting these conversations through advanced care planning and pointing out that there are great resources that are available. And so I wanted to point all of you to some of these materials. I go there every day to on anthc.org under palliative care /resources. We've got a number of advanced care planning resources that are just a click away, and you can print them out. No matter where you are, you can easily access these. And then I know printed materials are also located at a number of facilities across the Alaska Tribal Health System, so you can get a nice colored printed version if you needed them. So just to outline some of these resources, I wanted to start off with the Advanced Healthcare Directive. So the POLST form that we're going to talk about today is not a replacement of an Advanced Healthcare Directive. It's an extension. It is an order set that puts medical wishes and translates them into medical orders. What's special about the Advanced Healthcare Directive that was developed at Alaska Native Medical Center was that we knew the POLST was coming. So back in 2016, when this form was developed, we actually made it so that it was easily translatable to the Alaska POLST. And we're actually working on just making some slight revisions so it's that much easier to translate it over, so that this way you can just have one conversation for advanced healthcare directives rather than having two separate conversations, one for the advanced directive and one for the POLST. So the hope is that that by filling out an advanced healthcare directive, you can easily complete the POLST form and have it go hand in hand. The Advanced Healthcare Directive that we use at the Alaska Native Medical Center through Your Care, Your Choices, it's actually written at a 6th grade reading level. So it's designed to really address the needs of Alaska Native communities and whether it's rural or urban settings. And so that's the other thing. And it integrates a lot of personal preferences in that form. A part of that is the conversation guide, because what we heard across Alaska is that these conversations are hard. And so, and to be culturally inclusive and sensitive, we realize that using the theme of being prepared is so important. And so the Your Care, Your Choices conversation guide is a booklet that goes with the Advanced Healthcare Directive so that this way, it's not only an educational guide that can be given to patients and families, but for us as healthcare team members, it's a facilitator guide, guiding us how to have that conversation, what questions to ask. And it goes page by page with a form. And the other thing that was important, that it's easily translatable, no matter what region of Alaska you're from. It also incorporates storytelling. That's such an important part of the Alaska Native culture is the foundations of story. And so it uses real life scenarios in the beginning of the conversation guide, just to show and point out that no matter what age, whether you're young and healthy, you could have a serious injury or illness that could happen unexpectedly, or it talks about someone with cancer and going through that progression of disease, as well as our elders and looking at frailty and in complex comorbidities. It's also, as I mentioned, a facilitator's guide. And so you'll notice that as a facilitator's guide, that there's actually scripting that's written in blue, so that as a provider, you could either use the scripting to guide your conversation, but it also has open-ended questions, so that this way you know how to bring up these topics in a culturally sensitive way. And then, as I mentioned, the content is in the conversation guide is linked by the page numbers of the Advanced Healthcare Directive. So before we jump into the POLST and focusing on the POLST, I just wanted to remind everyone, where do you find advanced care planning documents, including the POLST? So within Cerner, there is what we call a tab or an M page. And so if you go to any of the ambulatory summary pages, you will be able to find the advanced care planning tab that's there, or M page. And it's also in that banner bar. You'll notice it'll say advanced directive. And if they have an advanced directive, it'll be listed. It'll say advanced directive. So that means that something exists, like a POLST form may exist in the advanced care planning tab. The other thing is now on the side of the EHR, we actually have a little alert that will let you know that there's an advanced directive and to look into the advanced care planning tab or M page. When you open up the advanced care planning tab or M page that I was talking about, this is what it looks like. You'll see that the documents are all clearly labeled. We created 5 note types: advanced healthcare directive, expected home death form, healthcare power of attorney form, comfort one, in the POLST. And so those will all exist on that advanced care planning document section, so you can find it. The other thing that we commonly heard about is that sometimes, in institutions, our patients and families are bombarded with the question, do you have an advanced directive? Do you have an advanced directive? And within one hospitalization, sometimes they may be asked 3 or 4 times over and over and over. And so one of the tools that was developed that's on that M page is an ad hoc form for advanced care planning, so that as healthcare team members, we can easily and quickly document that we had the conversation, that it was either introduced or reviewed, the advanced healthcare directive. And then if it was declined, we can also document that, so that this way, as a team, we can work together knowing that we've already approached these conversations. So now I wanted to really start to transition and talk about the POLST and dive into some of the details about what is the POLST, what does it stand for? And so we're gonna talk more about that. So the POLST form stands for, and specifically, this is the Alaska Physician Orders for Life-Sustaining Treatments. There's a number of healthcare team members who have worked across the country. This is a national movement, the POLST, and it's called things in different states. In Alaska, we chose the POLST. If you go to New Mexico, where I worked for a while, it's called the MOST form. If you go to Vermont, it's the COLST form. So there's different names, but it's all a part of this national paradigm called the National POLST paradigm. So the POLST is a tool, as mentioned, for seriously ill patients. And it's really all about communicating their medical wishes for treatment in an emergency situation when they're critically ill or at the end of their lives. And the POLST is actually, and the Comfort One protocols are backed by state regulation in reference to statutory law. And so, you know, these laws or regulations define the medical orders, and they're required now by all healthcare providers, you know, to be followed, and for all institutions to be able to follow these medical orders. So I wanted to take a little bit of a moment, especially for those who are new. So the Comfort One program, which I'm going to just jump over to the next slide, it kind of shows the progression of when all these forms were instituted. So I just wanted to share with you, it was back in 1994, there was the Patient Self-Determination Act that really started getting these federal laws in place regarding around patients' rights per state law to make healthcare decisions. And the Comfort One program was adopted back in 1996. So it's one of the reasons why, if you've ever used a Comfort One form, it's got this antiquated triplicate form that is numbered, and you have to order it through the state. It's really cumbersome to use. So that's the exciting thing about the POLST, and some of the differences that I wanted to outline is that the POLST can actually be printed out online. So no matter where you are, you could easily print it out, and that document is now official once you print it out. Whereas the Comfort One, you actually had to have a numbered version of that form. The other thing that's interesting is that the Alaska POLST can be faxed. And if you have a copy of the POLST or its faxed version of the POLST, it's still valid. So that's another difference between the Comfort One program and the POLST. The Comfort One program, the order only really applies to first responders and EMS. It's an order that tells them that this person is a DNR, do not resuscitate, no CPR, no advanced airway. That's what the Comfort One order was. So if they had a Comfort One, that's what it meant. Now the Alaska POLST program is a number of different orders, and we're going to talk about that as we go through the form. So that's another difference, is that the Comfort One was just a DNR order, whereas the Alaska POLST has more different choices that you could select and communicate. And as I mentioned, it was adopted by the states accepted into regulation back in May of 2021. And so the POLST program had officially been put in place, but it's being officially launched right now, January 1st, 2022. The other things I was just going to share with you is just to let you know that another difference is the Comfort One required a physician to write down a terminal diagnosis. The POLST no longer has a line for you to write the terminal diagnosis. It's just accepted that if you have a POLST form, you have a serious illness or advanced medical frailty. And so that's part of our job as a physician signing this form, is that we're stating that this person meets that criteria. So just a couple of things. As I mentioned, there are laws or statutes in our state constitution. So the POLST is official because of regulations that were put upon the Comfort One program. So it replaced the regulations of the Comfort One, and now there's the POLST regulations that sit upon those laws or statutes. So it's really up to our institutions across the Alaska Tribal Health System to put in place the institutional policies and procedures so that the POLST just becomes a part of the culture of what we do within our system. The other thing that I was just going to mention And this is where the nuances come, because there's a lot of advanced practice providers who do such incredible, important work. And there's been a question of why can't an advanced practicing provider sign a POLST form or even a Comfort One? And the reason why, because we wanted to make it providers' orders for life-sustaining treatment, it's because of the Alaska statutes. The Alaska statutes say that a do not resuscitate order has to be signed by a physician. And because of Alaska laws and the way the laws were written, that's why the POLST form requires a physician's signature. So I just wanted to get that out there because I know that question comes up quite frequently. The hope is down the road. We would like to try to change the statutes to broaden who can sign a POLST form. But that's something that I know is kind of on one of the things that they would like to do in the future is to update or that statute. And statutes are pretty hard to update or change because it has to go through the whole legislative process. So the POLST form, and this just kind of defines a little bit about do not resuscitate and who it applies to. And so I would just share again, the POLST form should be someone, a patient that you're working with, that you would say, gosh, I would not be surprised if my patient died in the next 1 to 2 years. If the answer is no, I would not be surprised of them dying in the next 1 to 2 years, you really should think about completing an Alaska POLST form because that likely means that they have some kind of advanced serious illness or injury or an advanced frailty. That's kind of the population that we're talking about with these order sets. I already kind of touched upon this, but again, it was in 2021 that the POLST program regulations were approved and signed off. And so the POLST program was just started where the state is now saying we should be now using the POLST form rather than the Comfort One form. And that started January 1st of this year. And so the other thing I wanted to touch upon with this slide is that there are a number of providers who have seen what we call MOST forms. And the MOST form is another form that's been used in Alaska that's a bit confusing. So places like the Pioneer Home, Providence Extended Care, PTCC, which is also Providence Transitional Care Center. There are a lot of facilities that were using the MOST form as a communication tool. And so it's gotten a little confusing in our Alaska Tribal Health System because sometimes EMS will bring a MOST form from these facilities. But I want you to know that the MOST form is not legislatively backed. It is not an official state form. It really is more of an institutional form that was used within the institution for communication. So we should not follow a MOST form if we see one as we do a POLST form. The hope is that the MOST form will completely go away, and because the MOST and the POLST have pretty much the same information on it. So our hope is that these institutions that use the MOST form will get rid of them and start using the POLST form instead. So I just wanted to bring that up about the MOST form. So a couple of things to know about is that, again, it's important to just make sure that the POLST, which are actionable medical orders when signed by a physician, reflect what's on an advanced healthcare directive. So my advice to everyone is that we should always start with an advanced healthcare directive and translate that over to a POLST. It should be a part of that same conversation because the advanced healthcare directive and the POLST should be together and reflect the same wishes. So that's an important part to think about. The other thing I would share that's different than a Comfort One is the Alaska POLST, now that it's backed by Alaska law, it requires all healthcare professionals to honor the POLST orders. And so what I want you to know is no matter where you are across all healthcare systems, we now have portable orders that go across the system. So if someone is transferred from here to Providence or Alaska Regional or up to Fairbanks Memorial, the wonderful thing is those orders are followed no matter where you go. And so that's an important thing. The other thing is, why do we need these orders? So what's interesting that I discovered, working up here in Alaska, is the Alaska Advanced Healthcare Directive. Even though you write that you do not want to be resuscitated if your heart stops, EMS or first responders are not allowed to follow the wishes written on an advanced healthcare directive. All first responders, including EMS, are required by law to start resuscitation. And they have to start resuscitation, including CPR, and be brought to an emergency room or to a higher level of care. When they get to the higher level of care, it's up to a physician or medical provider to interpret the advanced healthcare directive to determine whether to continue CPR or to stop CPR in resuscitative efforts based off of the wishes that are outlined in an advanced healthcare directive. So the Comfort One and the POLST program, Alaska POLST program, those orders now can follow the patient in the home setting, in the village setting, no matter where they are. So now EMS can follow those orders, and it's a way to protect the wishes of someone who does not want aggressive treatments such as intubation and CPR. And so the Alaska POLST now allows that to be the case, having that form on file. Another thing to know is the POLST form has no expiration date. And so once a POLST form is completed, the POLST form is good for the rest of that person's life. If their wishes change, you can fill out a new POLST form. And whatever the latest form that exists is now the legal form that we follow. So again, the most recently completed form is the legal order. And that also goes for Comfort One. As soon as a POLST is in place, the Comfort One is no longer a valid form. So I wanted to take some time to actually look at the form and the choices that are on the form. So as we look at this form, there are actually sections A through D. And so this slide actually will talk a little bit about sections A, B, and C. If you are filling this form out, really section B is one recommendation that I've heard that I agree with is kind of starting out with that middle section. Because the middle section in section B, if your patient or customer owner says to you, I would like to have selective treatments or comfort-focused treatments, automatically you know that you should advise or direct them not to do CPR, because everyone who receives resuscitation with CPR is going to require the need to go to the intensive care unit and likely need for mechanical ventilation and intubation. And so that's one of the reasons why in section A, it's a straightforward thing. Do they want CPR? Yes or no? And as medical professionals, we need to say that if they do select CPR, they have to select in section B full treatments because of the fact that they're going to need intensive care unit support. In the Alaska Tribal Health System, this is a big deal and a big question, because a lot of times if someone wants to stay in their village or their regional or remote setting, the fact that they get CPR means that they're going to likely need to wind up in a higher level of care. Most oftentimes that means coming to Anchorage to be able to be in the intensive care unit, to be on mechanical ventilation, intubation, and get that higher level of care. So that needs to be a part of that conversation. So if someone has serious illness and is wanting CPR, they need to know that they're going to likely, especially at the end of their life, they may end up dying outside of their village or outside of their home setting if they don't have that higher level of care nearby. Section B breaks down to full treatments, which really is full treatments means all the medical and surgical treatments that are appropriate to prolong life. And that includes the intensive care unit and, like I said, mechanical ventilation, intubation, dialysis, all those higher level of treatments. Some people may choose that they want selective treatments, which is the middle option, which means that they want to restore function. So for example, maybe they have an infection that can't be treated with oral antibiotics in the home setting. Maybe they need admission where they need antibiotics that are given via IV or IV fluids or other things where they need to be hospitalized. And going to the emergency room or being hospitalized might be appropriate. Maybe they need non-invasive positive airway pressure, like high flow nasal cannula to get through like a COPD exacerbation or something like that. But selective treatment means they want to avoid going to the intensive care unit, getting intubated. And so I really like this next slide because it has an algorithm that just shows you that if someone wants either selective treatments or comfort focused treatments, that typically means that they want to be do not intubate. So it's not only a do not resuscitate, but it's also a do not intubate because they do not want to go to the ICU. Whereas if they want CPR and full treatments, they can put that down as well. And someone can choose Section A for CPR, yes, which means that they'll get all full treatments. There are some people who may not want CPR, but yet if they had a respiratory illness or a COPD exacerbation, they may want to trial going to the intensive care unit and being intubated on a trial basis to see if they can get better. And so there may be some people who don't want CPR, but yet who still want full treatments, including going to the ICU to see if they could get better. So I just point that out because that's a wonderful thing. That's an improvement from the Comfort One, is people can choose not to get CPR, but still choose to be intubated and get full treatments within the hospital setting. So I like this algorithm because it kind of outlines that. Section D talks specifically about medically assisted nutrition. And so just to kind of share with you, our advanced healthcare directive also has that on there too. So again, what's nice is there are some people who are just like, yes, I would like to receive artificial nutrition if medically needed or appropriate. And they may want to provide feeding through new or existing surgically placed tubes. Sometimes people are like, sure, I'd be open to a trial of artificial nutrition, but I do not want surgically placed tubes, and which means that they don't want to be sustained or kept alive long-term on artificial nutrition. And then there are some people who are just hands down, nope, I do not want artificial nutrition at all. And they can choose that. And then, and sometimes it's just a hard conversation. People may say, I have no idea. So it gives you the option to say that, you know, no decision was made. We discussed it, but they decided not to put a preference down. Other thing to know about that section, it's important to know that, you know, offering food by mouth, if desired, is always the ultimate preference, especially at the end of life. But I want you to know in instances, you know, with the Section D, is that it does not apply to IV fluids. If someone does not want IV fluids or does not want blood products or dialysis, that's where the additional orders or instructions in Section C can be really helpful. So you can put those nuances there in Section C. So how does this get signed? So it is highly, highly, highly encouraged that a patient or the patient representative sign the form when that discussion is had. And if there's a guardian or a healthcare power of attorney based off of the healthcare agent that's on an advanced healthcare directive, if someone doesn't have medical capacity to sign it, then you would have the surrogate or healthcare agent or guardian sign that form. And there's that section. If it's a guardian, a legal guardian, oftentimes the physician will sign it and you will have a non-opposition letter that's attached or a part of the record showing that they do not oppose the orders of proceeding with a POLST form. So just know that that's another wonderful upgrade to the Comfort One, is it allows lots of different representatives to be able to sign this form. But really, you'll notice it says optional. There are times where a physician is not in a rural clinic setting. And so there is the ability to be able to do verbal orders or to have the physician sign it by themselves if they're not with the patients while they're having that conversation. The physician who signs that is saying that they fully confirm that the patients or representative, that what's written on the POLST form reflects the medical wishes of that patient or representative. On page 2, and this is another thing that's really helpful that's different from the Comfort One. If there is someone else, like a social worker or a nurse or an advanced practice provider who is completing the POLST form, there's actually a section on there where you can fill out that I was the one who had this conversation, and then the physician can sign it. But at least it denotes that someone else had the conversation and the physician confirmed those medical wishes. But it's nice because you can capture who actually filled out the form with the patient and the family members. And then the other areas, just again, confirm whether there's an advanced directive on file. And so, so when does the POLST take effect? And I already mentioned this. So January 1st of 2022, it took effect. All of us should start using the POLST form. I want you to know that the Comfort Ones will always be honored. So if someone has an old Comfort One, you're not required to replace the Comfort One with a POLST. It will still be honored indefinitely. It's highly encouraged that we start using the POLST form instead of Comfort One forms. But the state is giving us about 6 months to start to fully transition to the Alaska POLST form. So they will be renewing orders for the Comfort One forms, but starting in June, they will no longer be issuing out Comfort One forms. They're going to really advise everyone just to use the Alaska POLST form. So I just wanted to make everyone aware of that. So where do I get paper POLST forms and more information? So I want everyone to know about the www.alaskapolst.org. So it's akpolst.org. This is your website if you have questions or need more information. It also has wonderful patient and family brochures and handouts that you could just print off their website. And it also has a wonderful toolkit for physicians and providers and healthcare team members under clinician resources. And this is just a picture of the website so that you know that it's out there and it's live right now if you want to learn more. And this is under the clinician section is the clinician toolkit. And when you click on clinician, this is where you find the form. It's a PDF blank form that you can pull up and print out. There's also the Alaska POLST program guide that is about I think it's like almost a 30-page guide that goes through all the details of how to use the Alaska POLST program. There's also a clinician fact page. And just as Kyle had mentioned, there's a lot of really great upcoming events for more trainings. And so if you go to the website, you can actually register online for different courses to learn more about the POLST form. And so you'll notice January 25th, there's one for hospitals and ER departments. And then there's a whole palliative care Project ECHO that is dedicating the next 3 echoes to the POLST program. So there's a lot of great trainings that are out there that are coming up to learn more. And just as a reminder, and I wanted to include this, you know, if someone doesn't have an advanced healthcare directive or a healthcare power of attorney form, just remember that the statutes guide us on the hierarchy of who are the decision makers. So again, you first look to see, is there an advanced healthcare directive? If not, do they have a guardian? If not, did the patient designate a surrogate before they lost capacity? If they did not, then you go to the spouse, an adult child, or an adult sibling. And then the last one is pretty broad. It's basically any adult who exhibited care and concern for the patient, who's familiar with the patient's personal values. So just know that that's kind of the hierarchy of determining who has the ability to help someone who doesn't have medical capacity. And I included some of the references and Alaska statutes that support the do not resuscitate, and outlines kind of what does Alaska law say is a terminal condition. And also they have a term called permanent unconsciousness. So just know that I included that in my slide deck. And then I also included some of the immunities of end-of-life decisions, because I know it comes up that, boy, they have a POLST and it says they do not want to be resuscitated. And then all of a sudden you get family out of the woodwork who are saying, no, 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 we really feel strongly that this needs to be reversed or changed. So just know that there are protections. So if you feel very strongly that the POLST, you know, like if there is not a decision maker that's available and someone is threatening that you should change or go against the POLST, there are immunities for us to make sure that we're able to follow the POLST form and that we're not going to be sued or there won't be repercussions afterwards for following the wishes that are on the POLST. So just know that that's there. I wanted to make sure that I left, I'm going to look at my time. I wanted to leave about 15 minutes for questions. I know I covered a lot of different things, but I hope this is helpful to at least introduce you to, you know, the great things that are coming with the Alaska POLST. And I'm always here as a resource for anybody to ask questions. And so, but just wanted to turn it over to everyone to see if you had questions or wanted me to talk a little bit more in depth about other things. So.
I had a quick question.
Yeah.
Michelle Kimbrell, I'm a social worker here at ANTHC. Great training. I appreciate it. Thanks, Dr. Paramelli. So one of my questions were, given kind of the setting that we're in with visitations being so strict at this point, when it comes to consent from the guardian, the medical decision maker, whomever, if we're unable to get them here, can we do a verbal consent on the phone with the witness?
Yeah, and so what's wonderful is what was written into regulations is that, and it actually says it on the form as well, which is helpful. You can do verbal orders, and verbal orders are accepted. It says that it's important that a signature is acquired from a physician. So just a couple of things. So I was just going to say verbal orders from a physician are accepted. So just know that. But just know that as far as getting the signature from, you know, the healthcare representative, whether that's a healthcare agent or healthcare power of attorney or surrogate, it's not required. You do not have to have that signature on the form. And I think it's for instances like now, especially with the pandemic, as long as you have a physician's signature, you know, that form is valid. If you're talking about verbal orders for the physician, it actually says it on the form that verbal orders are acceptable. If you look at the regulations and the guide, it just says that it's important that we still get the physician to sign it at some point and get the copy back to them. So, but that's a really good question, Michelle.
Thank you.
We have another question in the chat here. It says, I seem to remember there is a POLST exception for patients in nursing homes. You don't have to have a serious illness or impending death within 2 years. If life expectancy in the US is 79 years, then can a POLST be issued at 77 years because it's reasonable to anticipate death in 2 years? Is there a bracelet or some other ID that would be recognized by first responders so CPR would not be attempted? And why do you have to have a terminal illness in order to make these decisions? So kind of a few questions there.
Yeah, no, these are great things. So a couple of things that I'll just share broadly. So the Comfort One really required us to put down a terminal diagnosis, right? So it had a line that the physician had to write down, this is why I'm doing the Comfort One. This is the terminal diagnosis. The Alaska POLST form does not have a place to write down a terminal diagnosis. What it says is that it's really up to us as healthcare professionals to determine whether the Alaska POLST is appropriate. So for example, if I have an 89-year-old, right, who doesn't have a terminal diagnosis, but has advanced age, right, and overall, maybe they are incredibly osteoporotic, right, where CPR would be just detrimental to them, you could make the case that they fit under medical frailty, which is included in the regulations of the POLST, you know? So again, it's really up to the discretion of the medical provider to define serious illness or frailty, because those are the two words that are used, serious illness, injury, or frailty. So I hope that that helps. Going back, I agree. So one of the things that I'll share with you is that we still have to follow Alaska statute, which is the law of the land in Alaska. And it's Alaska statutes that kind of dictates the terms of the broader terminal condition, in a defined terminal condition. So it kind of gives us some guidance as to what things look like. So in Alaska, the POLST regulations have to conform to Alaska statute or law. And that's why, you know, again, your other question was, you know, why is it that they have to have a terminal condition? Or why is it that they, as a provider, we have to say, gosh, I wouldn't be surprised in the next 1 to 2 years that this person could die. That's because of the laws of Alaska, you know, and we have to fit the regulations under those laws and follow them unless the statutes are changed in the future. It's the same reason why an advanced practice provider is not allowed to sign a POLST form or a Comfort One. So the other thing I was just going to mention is, and this is really important, the Alaska POLST, just as the Comfort One, it serves as an expected home death form. So this is really, really important because if someone dies in the home setting, whether it's a child, like a child with serious illness or an adult with serious illness, if they're in the village setting or whatever setting they're in, if they end up dying and they don't have a Comfort One or an expected home death form, it could, again, Alaska statute dictates that they may need to be sent to the medical examiner, which means that after the person's died, law enforcement may have to investigate into the death. They may even have to send the body out of the village or out of their setting to go to the medical examiner for further investigation. I have heard just heart-wrenching stories about families who had to go through that process after their loved one died. and it can be kind of traumatizing. And so having an Alaska POLST serves as an expected home death form, so that this way, if law enforcement comes, they could say, oh, this was expected, you know, and this form serves as that. And so that's what's being communicated across law enforcement throughout the state. So that's the other big thing I wanted to share that really affects our Alaska tribal health system.
Couple more questions here. Sometimes some couples may still be legally married but separated for many years. They didn't get legally divorced, as legal services can be a barrier in the village. Oftentimes the patient can be with another partner. Is there anything that we can allow for the current partner to do, or is something that needs to be asked to remind them that when they're completing this note to their current partner?
Absolutely. I'm so glad you brought this up, because this comes up all the time. My goodness. So it's important to ask if, you know, if they're separated or like if they're legally married, Alaska statute dictates that we have to go to the spouse, their legal spouse, even though they may have been separated for 20 years, we're required by law to go to that spouse to be the medical decision maker. The way that say, new partner can become the decision maker is by simply filling out an advanced healthcare directive or a healthcare power of attorney form. By filling out that form, they now have the highest authority to be the medical decision maker when that person loses medical capacity. And so even though there was a legal spouse, the Alaska law says that we have the power to designate whoever we want. It could be a neighbor, it could be whoever we want to be our medical decision maker when we lose capacity. And that's why an advanced healthcare directive would be the simple solution to make sure that that goes in effect. And then of course, having an Alaska POLST that reflects who the emergency contact is based off of who that healthcare agent or healthcare power of attorney is. So I hope that helps. But I would say that is the most common thing that I use to encourage someone who's young to fill out an advanced healthcare directive. Because I'll say to them, I just want you to know, I would hate for Alaska law to tell us who to pick as your decision maker. I want you to be in control. And that first page of the advanced healthcare directive is probably the most important part of the whole entire advanced healthcare directive. And that's picking out the healthcare agent.
All right, we probably have time for one last question here. Can the POLST be shared in advance with law enforcement and EMTs?
Yes, and I'm so glad that question was asked. You can share in advance with law enforcement. Here's a couple of things that are important to that question. First of all, the Comfort One used to be faxed in to local EMS. The Alaska POLST is no longer going to be kept by EMS and first responders because they don't have good systems to keep track of whether they have the latest form or not. So just know that that part of faxing in the form is no longer there. The other piece of this is I'm sure you could send it to local law enforcement, but they probably have no way of storing those forms. But just know that the statutes actually say that we should be sharing it with local law enforcement. So I think it's still too early to know how they're going to store forms if you do share it. The other thing I'll share that's exciting is written into regulation. We are planning as a state to have an electronic registry. So that's another reason why it was only physician signature required, is because we may be doing an electronic signature as a physician to have it stored in a registry. And so one thought that's been tossed around is the PDMP. You know, there's actually a button that can be turned on so that it can be integrated with that. So coming soon, an electronic registry, which will hopefully solve these issues.
So the POLST will go with the patient.
Yes, and I think that's a critical piece, is that the patient and the family are responsible for the POLST. We need to educate them to put it on their refrigerator, put it over their bed, put it at the front door. And again, they can make as many copies as they want to make sure that it's in all the important places that they need.
So then as a facility, we're ensuring that that's scanned in within our system and our EHR. And then to update it, you would just execute a new POLST, and then that in theory trumps the other one, correct?
Exactly. And when it gets scanned, the most recently scanned document is seen first. And that's how our Cerner has been developed. The other thing to know is that a patient always has the right to void a POLST. Say they decide they don't want it, and all they have to do is write void on it. And then you just let them know that they need to send it to healthcare institutions so it can be rescanned into the system to say void.
And I'm guessing then this will be honored by our medevac companies by where they're needing some sort of order set while they transport patients. So, okay, very good.
Absolutely. Everybody will.
Great. Thank you.
Yeah.
And as an organization, we're moving this out effective immediately, given we have like 6 months to kind of be done with the Comfort One.
Correct. And the fact that it's, now in regulations, it's something as an institution, we need to make sure that all of our institutional entities within the Alaska Tribal Health System have policies and procedures that reflect this change to regulation.
Awesome. Thank you so much for taking the time to present. I think we can probably wrap it up here just to be respectful of your time. Really appreciate you putting all this together and all the hard work you and the team have done to put the POLST together for the state of Alaska.
Well, I just want to thank everybody. And again, I'm always a resource too. So if you have questions, I'm always happy to help. And I'm sure we're all going to be learning a lot as this gets instituted across the state. Okay. Thank you for your time. And thank you for all that you do, everyone.
Thank you. And if anyone wants to be plugged into more information, feel free to go to that website, AK POLST, and there's additional webinar series that are offered that can provide continued education on that as well. So thank you, everyone, and we'll see you again Friday.